today I am going to be talking to you about low back pain and sciatica. I'm going to show you a little bit of the anatomy first. We got the human spine here. We start up at the top with cervical segments. We have 7 vertebrae, which is the bone of the spine and the cervical spine. And then you go through the thoracic spine. We got 12, and then the lumbar spine, we have 5, and then you go into the sacrum, which again we have 5, and then the coccyx or the tailbone, which we have 2 or 3 segments. As I mentioned, I'm going to talk about sciatica. Now what sciatica is pain that shoots down the leg, and we're going to talk about a few different ways that can happen. And today we're talking about one of the 3 most common causes, which is stenosis, arthritis, or degeneration. There's a lot of medical terms thrown at this, whether it's degenerative joint disease, degenerative disc disease, arthritis, spurs, all of that stuff. So we start off with a healthy spine. The bones are nice and smooth, and as we age, those bones become very jagged through different trauma that may happen, different wear and tear on our bones. And the bone will re-heal itself, and when it does, it kind of overheals itself and it becomes jagged. And many times that's called a spur. And then the disc is the cushion between the vertebra. And I like to think of the disc being a nice, fat, fluffy marshmallow when we're young. And then as we age, those marshmallows dry out and they become thinner and thinner and thinner. And as they do, in between each segment on the spine, they get closer and closer and closer. And in between each segment, those nerves that come out get impinged. So you've heard of a pinched nerve or an impinged nerve. That's how that happens. Now the nerves in the spine innervate your arms, the nerves in your low back innervate your lower legs, and when one of these are pinched, it's going to shoot pain down your leg and cause sciatica.